The abdominal cavity lies just below the rib cage and above the pelvic cavity. Unlike the chest and the pelvic areas, there are no bones to protect the abdomen, and any injury will cause serious damage to the internal organs. The internal organs that could be injured include your liver, your spleen, or your stomach. It can also be that there are injuries to the pelvic and the abdominal region. The actual contents within them could require urgent medical assistance. Different organs react in different ways when they're subjected to any kind of trauma. Hollow organs, such as the bladder, tend to rupture, releasing their contents into the surrounding space. Solid organs, like the liver, tend to tear instead, and they have bleeding. This may well be quite slow and overlooked. Signs and symptoms include bruising, bleeding or an obvious injury, pain, inability to stand, holding the injured area, and finally, nausea or vomiting. Treatment is to place the patient as comfortable as possible at total rest. You may need to help them to lay down, usually on their back or on their affected side. Having their knees raised will help to release the spasms and pain. Ensure their clothing is loose, support them with pillows or blankets for comfort if needed, and give them frequent reassurance. If trauma has caused the victim's internal organs to protrude outside the body, then do not touch them or try and push them back in, as doing so will cause greater complications. Instead, have the person lie flat with their knees bent and cover the organs with a moist, sterile dressing composed of a material that will not stick to the affected organs. Do not allow the patient to eat or drink, although they may be complaining about extreme hunger or thirst. Finally, it's most important that you get immediate medical help as soon as possible. The job of the first aider is to stabilize the patient until professional help arrives.